Welcome everyone. So excited to have you all here with us. Bonjour tout le monde. We are so grateful that you've taken the time to join us here today for this discussion that we're having on what we're calling being committed to deliver. We're here talking about the very real implications of the current context of COVID-19 on your operations, on the work that you're doing. We know that there's many different competing priorities and demands that folks have going on right now, but we've heard loud and clear that it's important to have a space to talk about the challenges that all of us are facing at a operational level, but also at an implementation level. My name is Jessica Fern. I am the Director of Global Health Impact at CanWaCH, the Canadian Partnership for Women and Children's Health. I see that many of you here are members of CanWaCH, but also some of you are not, and everybody is welcome. We're all thrilled that you've taken the time to join us here today. I'm joined here as well by several of my colleagues from CanWaCH. Most of us have put CanWaCH next to our name so that you can see us. As well, my colleague Caitlin Reed is currently sharing her screen and can also provide some technical support if you need that. A few logistical notes about today and how today is going to flow. This webinar is being recorded. We will make this webinar, as well as any of the resources that we mentioned, available immediately after, or as close to immediately after. I shouldn't say immediately, but as soon as possible on our website. If you registered for this webinar on Eventbrite, you will get the link. We'll make sure that you get the link. We will also momentarily share our email information, and you can always reach out if you don't get it and want to follow up. We are also very thankful to be joined today on the call by some of our colleagues from Global Affairs Canada. They'll be sharing the most recent intel and information that they have. And so we will be sure to follow up with them with a summary of what comes out of this call. But of course, we won't be attributing anything to you by name or organization. As you see up on the screen, we've got our agenda for today. We're going to start off by just giving you a bit of a basic overview of what we've heard so far. Some of you shared with us in advance some of the operational issues and questions that have come up, and some of the things that you're hoping to discuss. So we'll summarize what those are. Then we will turn it over to our colleagues from Global Affairs, particularly those who are working in the health teams, to share what they know and what they can share with us, and what updates have happened since last we were together. And then we're going to open it up to a wider discussion. We have invited some colleagues to share some of their experiences that they've already imparted with me at other moments about the challenges that are currently affecting their operations in country, strategies that they're using that might be helpful to you or to others, but also to talk a little bit more about where, in the absence of clear additional information or direction, as all of us try to figure out what's next for us, how can we as a sector kind of present a collective voice? Are there decisions or strategies that we can decide together make sense to take and be propositional in working with our global affairs colleagues and other partners and funders to talk about what would be most helpful? And then we will wrap up with talking a bit about what next steps are, how we can, at CanWaCH, can support that to happen, how we can connect you with each other so that you can continue to be a resource. Obviously, because we are CanWaCH, and given the nature of what's happening, we have a particular interest in, of course, global health programming and the intersections with gender equality. But we know that for all of you, many of you work in a variety of areas and work on the broader social determinants of health issues, and we will definitely take a wider lens to that, and comments on any elements of how it's affecting your work and your programming are most welcome. I also want to quickly introduce my colleague and webinar co-host, Melody Tondeur. Melody, would you like to say a few words?
Bienvenue à toutes et à tous à cette rencontre virtuelle. Comme l'a dit ma collègue Jessica, ce webinaire va être enregistré et les ressources mentionnées seront partagées par la suite. Nous avons entendu qu'il était important pour certains d'entre vous de se réunir pour échanger sur les défis de la situation actuelle liée à la COVID-19 et surtout de discuter de l'impact de la situation sur les activités et les partenaires sur le terrain. Jessica, à toi la parole.
Merci, Melody. All right. So to begin, I just wanted to quickly, many of you have been, I've seen your faces or seen your names. I know we've been on many different online discussions, so we don't want to rehash what's already been shared. What we will do in the resources that we're sharing is we'll link you to some of the other great compendiums of resources that our colleagues at CCIC, OCIC, and other coalitions and councils have made available, because there's some great resources that you might find relevant. But when we invite through those calls, we've been listening, and as well we sent out a questionnaire to many of you about some of the operational based challenges that you're facing and the questions you have. And I thought I would quickly kind of summarize that before we turn it over to global affairs. So a couple of the things that we heard that are top of mind for folks, and I've grouped them into a few buckets here. So one of them is questions around cooperation and collaboration opportunities. So there's a real hunger for that on a variety of fronts. First of all, we are dealing with a time of uncertain funding. And not necessarily knowing and having a lot of money related questions and anxiety. So we've heard from folks who want to know a bit more about how we might be able to partner together as organizations, potentially, whether that's sharing data, whether that is using, we'll talk about this in a little bit, but predictive modeling or impact analyses to reduce costs. Are there other ways that or other techniques that we can use to work together, help each other to keep relationships vibrant, even if one organization maybe doesn't necessarily have the resources at the moment? Are there ways that we can show that solidarity together on an operational front? Secondly, we had some things around responding to COVID-19 itself. One of the things that was announced last week was funding being allocated to humanitarian responses around COVID-19. And I was on a call last week where folks were asking about whether or not Global Affairs Canada would be accepting unsolicited proposals or responses to that. What we heard in the CCIC call last week was, of course, that organizations are, always able to submit unsolicited proposals. But of course, information is changing all the time. Do we have the information that we need to think about what a response would look like? And folks here have indicated that they would like to talk a little bit more about, for those organizations that are responding directly to COVID-19, but also looking at what it means to prepare their in-country partners. Many of you flagged in certain African nations in particular where you're working. How do we prepare those partners? And should that be something that we're rolling into our current programming? And what's the flexibility for that? The third thing had to do with what I mentioned earlier about being propositional, whether it's with Global Affairs Canada or other funders or stakeholders, in the absence of, very clear direction on certain things as we all find our footing. What can we as a sector do to be propositional about how we recommend going about, whether it's collecting data, delivering on programming, or other things like that? Fourthly, there was a lot of questions about the implementation itself. So your capacity and the capacity of your partners to work differently in this context. A lot of you talked about your work in humanitarian programming. How do you do the delivery of food when you have to maintain a physical distance from folks? What does this mean for the work that you do with, let's say, rural communities or in dense urban centers? What does does this mean for your programming in refugee populations or communities, work that you do with HIV affected communities or immunocompromised groups, persons with disabilities, elderly folks, any groups that might be facing particular vulnerabilities. Are there ways that we need to get creative with implementation, and how do we connect around best practices? The final two had to do with what I'd classify as kind of ethics and legal questions. So we've heard a lot in different calls about operational questions vis-a-vis your own staffing here in Canada and questions that people have about that. But how does that extend to the work in country with your global partners? How do we practice transparency and communicate with our global partners and hear from them as to what's happening, talking with them about where things stand with our projects. For those of you involved in research, how do we talk about issues of informed consent? And what does it look like to continue with that? And then the last thing, which is of course near and dear to my heart, has to do with impact measurement. So a lot of people talking about, especially for those projects that are currently sunsetting in their funding, how do we talk about the collection of end-line data? Are there other strategies we can use to talk about impact? And for those just beginning, what will this mean for the baseline or data that you collect? Again, we'll hear from folks, other organizations here on some of the strategies they're using, and talk about how we can work together to share a bit more on that. So that's a bit of a summary of what you shared with us. We know from previous conversations with Global Affairs that we've heard loud and clear that they are working very hard to monitor the situation, to make information available in a timely way. And I personally have been really pleased and grateful to see how available our GAC colleagues have made themselves for us, as they themselves are working from home and dealing with uncertainties. And we've heard some good advice about the importance of reaching out actively to the staff that you work with at Global Affairs, providing them with alternative means of contacting you as email gets overwhelmed, but also making sure to document the decisions that you're taking. So we're very pleased to have colleagues from Global Affairs here with us. Melody will, if you could do the introduction to those colleagues, and then we'll invite them to say a few words.
Alors maintenant, nous aimerions remercier nos 3 collègues d'Affaires mondiales Canada qui sont présents aujourd'hui. Geneviève Brown, directrice, Direction des partenariats canadiens pour la santé et la nutrition, Partenariat pour l'innovation dans le développement, ainsi que Jean-Bernard Parenteau, directeur général, Partenariat canadien pour la santé et le développement social, secteur des partenariats pour l'innovation dans le développement, et David Boucher, conseiller principal en politique, autonomisation sociale, Partenariat canadien pour la santé et le développement social. Geneviève va nous partager des informations sur la situation. Veuillez partager vos questions et commentaires dans la fenêtre du chat, s'il vous plaît, et nous les partagerons avec les collègues d'ANC après le webinaire. Please feel free to share your questions and comments for Global Affairs in the chat window, and we will share them with GAC colleagues after the webinar. Maintenant, Geneviève, à vous la parole.
Bonjour tout le monde, c'est Geneviève ici. Merci d'avoir organisé ce webinaire. C'est important pour nous de pouvoir échanger et aussi d'écouter et comprendre mieux les enjeux auxquels vous êtes en train les enjeux que vous êtes en train de gérer. On nous a demandé de partager quelques lignes. Alors, je vais commencer en français, puis je vais changer pour l'anglais. Ça va faciliter le rôle de traduction de l'équipe de CanWaCH. Alors d'abord, pour ce que nous faisons pour faire un suivi ou la gestion de la situation, comme vous tous, nous avons évidemment des contraintes sur les ressources et les personnes qui sont disponibles, et ce que nous sommes en mesure de faire actuellement avec la situation où on travaille de la maison, où on gère des problèmes d'accès. Alors, on priorise autant que possible le nombre de personnes qui peuvent répondre à vos questions et qu'on travaille avec vous. So first of all, I'll just do maybe a few points in one language, and then I'll switch to the other for everyone. But first, Thank you for having us today. It's important for us to be here and to be able to hear from you and understand the context that you're all living and dealing with right now. As many of you, Global Affairs Canada staff, our resources are strained. We are prioritizing as much as possible the people who are available at this time to be able to work with you and answer any questions that you have. So we do appreciate your patience. Ce que nous faisons actuellement, c'est que tous les agents de projet qui sont en contact avec vous, on prend note des questions, des situations que vous présentez, et nous sommes en train de coordonner des réponses que nous espérons pourront être publiées sous peu. Nous comprenons que chacun a une situation en particulier, mais ça va nous permettre aussi de voir quelles sont les mesures que nous pouvons prendre de côté contractuel et autres. So all of our project officers and all of your contacts are gathering questions and hearing what you're sending in. We are working on coordinated responses. We're trying to find the answers to these, and hopefully we'll be able to publish them regularly as some information is already being made available. But trying to find solutions to the problems that you're currently facing. Sorry, it's not to make an excuse, but I've been off for the last 2.5 weeks with pneumonia, so my brain is taking a little while to get back into action. So sorry. So we are working hard to provide you with regular updated information. I'm just checking to see what the other points we wanted to touch on were. As you know, and I think was also mentioned in the webinar with CCIC, we're trying to be as flexible as possible in terms of existing project requirements. But please do speak to your project contacts. Your officers are the ones who will be able to provide you with specific answers to any of your questions. As a general rule, we are encouraging officers and partners, of course, too, to confirm their understanding of any changes, to just make sure there is clear understanding of how we are operating, and ensure that this is documented, because this will help us in the long run when it comes to being able to look at the portfolio and what's happening. So, encore une fois en français, merci de votre patience. J'essaie juste de m'assurer que je prends bien note de tous les points que je voulais mentionner. Alors, nous essayons le plus que possible d'être flexible, de rester flexible sur les mesures que nous pouvons prendre pour chaque projet, chaque question. Mais je vous encourage de parler avec votre agent de projet, parce que c'est eux qui vont pouvoir prendre note de chaque situation particulière et vous aider avec la réponse. Mais on comprend bien que nous travaillons dans un contexte très particulier. Une règle générale pour tout le monde, évidemment, c'est de s'assurer qu'on a bien compris autant la question et la réponse, pour s'assurer que les mesures qui sont prises sont bien à l'intérieur de ce qu'on est permis de faire en ce moment, et de bien documenter. Comme ça, à partir du moment qu'on commence à ramasser et mettre les dossiers en ordre, encore une fois, on n'a pas perdu le fil des choses. When it comes to well, you spoke about this, Jessica, so maybe I'm not going to touch on it, but you spoke about the announcement for the 50 million in funding to help vulnerable communities and countries prepare for the response. There will be more information to share, I think, as this evolves internally in terms of what we are doing and how that money is going to be allocated. But we know already that 8 million of the funding is going to be provided to Humanitarian. Alors, Jessica, elle a déjà mentionné ça, mais comme vous savez, il y a déjà eu l'annonce du Premier ministre pour les 50 millions qui est mise à disposition de nos programmes pour aider les pays en développement et les communautés vulnérables à gérer la situation avec COVID-19. Puis, on sait déjà qu'il y a 8 millions environ qui sera mis à disposition pour les programmes humanitaires. And then I think Jessica also spoke to this a little bit, but in terms of recommendations for how to keep in touch with your officers, I think everyone has already maybe gone through this in the last week already. But arrange with each of your officers the best way to share information. We're all testing out all kinds of new technologies, and CanWaCH is a great example for us to follow in terms of virtual networks. So we know it can be done. But of course, check with them in terms of what they're most comfortable with in terms of Google Drive, Dropbox, any other document sharing systems. We recommend, of course, that you stay in touch with your officers because they will be able to share the latest information, but we are trying to support that, because we do recognize there's some connectivity issues. And we are in touch with CCIC and other partners too, in terms of being able to address any of the concerns that we're talking about today too, that are common across partners. Alors, je vais juste reprendre ce point-là en français. Évidemment, nous avons des enjeux aussi de connectivité, parce que c'est pas tout le monde qui peut être connecté en même temps. Alors, je sais que dans la dernière semaine, vous avez déjà été en contact avec vos agents de projet. C'est eux qui vont pouvoir partager avec vous la meilleure façon de partager l'information, soit Google Drive ou Dropbox ou autres outils, applications qui permettent de partager des documents. Nous recommandons évidemment de rester en contact avec eux. C'est eux qui pourront partager le plus rapidement possible les informations sur comment nous allons changer nos approches pour gérer les enjeux contractuels. Et on demande la patience pour gérer de notre côté aussi. Nous gardons le contact, évidemment, comme Jessica a déjà mentionné, avec CCIC et autres partenaires, CCCI en français, je crois, pour pouvoir aussi partager sur notre site les enjeux, des solutions aux enjeux qui sont communs à travers tous les partenaires. Ça, c'est environ ce que je voulais partager avec vous. Je sais qu'on va avoir des questions qu'on pourrait répondre aussi, mais j'inviterai Jean-Bernard à ajouter des éléments s'il avait quelque chose à ajouter. Merci.
I think, Geneviève, you're at the top of your game even after 2 weeks of absence. You've covered most of the points. I just want to add my voice to Geneviève to celebrate the resilience of all of you individually. You all have to go through more complicated lives on the personal side, on the professional side as well. I want to celebrate the resilience of your organizations. I know it's difficult already. I know there are already impacts for you. There will be impacts in the short, medium, and maybe long term for several of the organizations. So we're all conscious of that. Maybe just to complete a few points mentioned by Geneviève. As she said, we're coming into the 21st century at GAC. We're using Zoom for the first time and getting used to it, and it's a wonderful tool. So that's a good outcome, early outcome of the crisis. More information will eventually be available through our website. So following the discussions with CCIC last week, the various calls and webinars, you can expect eventually that information will be consolidated on our website, and we will make sure to bring that to your attention. You can expect as well eventually a communication from Caroline Leclerc to all of your organizations. Donc, en français, suite aux différentes discussions, notamment avec CCIC la semaine dernière, d'autres forums, vous pouvez vous attendre à ce que certaines informations soient consolidées sur le site d'Affaires mondiales Canada sous peu. Il y aura probablement des réponses un peu plus précises, des lignes directrices sur des questions contractuelles ou financières notamment. Vous pouvez vous attendre aussi à une communication éventuellement de Caroline Leclerc, notre sous-ministre adjointe. A few other measures that have been taken. I know a couple of calls for proposals have been extended. There's one on small and medium organization. There's an extension until April the 9th, if I'm not mistaken. And the Americas has another call. It's called Americas Women as Agents of Change. And the deadline for that one has been extended from June 1st to June the 30th. I know there's some discussion as well about increased flexibility for the annual reporting exercise as well on results. What else? And obviously, as Geneviève said, we will be flexible on the end dates for activities, end of agreements, if there's any need to consider some sort of extension. Just make your case, document it, send it to your officer. Donc, en français, certaines mesures supplémentaires récentes ont été prises, notamment certains appels de proposition. Les dates d'échéance ont été repoussées. Par exemple, celui sur les petites et les moyennes organisations. L'échéance a été repoussée au moins d'une semaine jusqu'au 9 avril. Il y a un appel de proposition dans les Amériques aussi sur les femmes comme agents de changement. Dans ce cas-là, l'échéance a été repoussée au 30 juin. Et puis, de manière générale, tel que mentionné par Geneviève, à Affaires mondiales Canada, on va être flexible pour des ajustements à la programmation, notamment pour des questions de date de fin d'activité ou de date de fin d'entente. Il y a probablement d'autres enjeux sur lesquels aussi on va montrer de la flexibilité, partager l'information avec vos agents. So, as I just said as well, we'll be flexible on probably on a broader array of issues, just document it and submit it to your officer. Some of your organization may still have payments and treatment, end of fiscal year payments and treatment. Just continue to collaborate with your officer if there's any missing information, and we still have the capacity to treat these financial financial payments, even if we're all working remotely. Pour ce qui est des paiements que certaines organisations pourraient avoir qui sont encore en traitement, assurez-vous de collaborer avec vos agents de projet, soumettre toute information qui pourrait manquer, et on a toujours la possibilité de traiter ces paiements-là. Message very important. I think you've heard it loud and clear already. If any of your organizations still have Canadians out in the field, the priority remains to make sure they come back safely home. And again, to make it very explicit, we will be very flexible if there's any need for increased financial resources in relation to repatriation efforts. Donc, un rappel, très haute priorité, ramener les Canadiens qui pourraient travailler pour vous sur le terrain. On va montrer énormément de flexibilité pour tout impact financier qui pourrait résulter de ces efforts de rapatriement. I think this is all what I wanted to add. We're really grateful to have been invited and to be able to hear the concerns and the questions that will be put forward. We won't have all the answers live today, but we're collecting them, and this is helping us inform the next few steps in the communication with your organizations. So over to you.
Merci beaucoup, Geneviève and Jean-Bernard. Right now, what we'll do is let's go into the discussion element of this. I think, a lot of the points that have just been touched on it's great to hear these points being reaffirmed, that they're, in no uncertain terms, that there are resources available for repatriation, and this needs to be a top priority. And I know everyone on the call has heard this loud and clear. In our various conversations that we've had with our own CanWaCH working groups, with members and elements of and other stakeholders, we have heard a lot about the challenges that your organizations are facing, and also that some of your in-country partners are facing. But rather than just hearing me summarize those back for you, what we thought would be most useful would be if some of those organizations could share that directly. What we'd like to invite you to do is we're going to call in a moment on a couple of partners who've agreed to share some of what they're grappling with and some of the strategies that they've used. If you want to respond, just because we are a fair number on the call, we invite you to, as Melody mentioned earlier, to write in the chat box, or if you would rather speak aloud or need to do so, there is the ability to raise your hand in Zoom, and we'll try to keep our eye out for that. If I miss you, though, we're all friends here, so feel free to come off and ask the questions that you have. But I actually would like to start, if I may, by calling on our colleagues from the Red Cross. I believe, Loué, you are on the call, if I'm not mistaken. Loué is a member of our metrics working group, an active member of our metrics working group, and had shared some updates on how the Red Cross is working, particularly in the settings where they are prioritizing and their work around women and children's health, what some of the major issues have been for them. Loué, are you on the call and able to come off mute?
Yes, thank you. A couple of things is that we work context with our operation. We work always with Red Cross and Red Crescent societies in each country. So that's our main point of entry and our main partnership. So every Red Cross and Red Crescent Society is mandated to be an auxiliary partner to the government, and especially in emergencies. So right now we are supporting those organizations in the countries where we're working in. And the support could be technical by issuing guidelines, supporting them, and how to work with their authorities, and also financially. The lesson we learned from the Ebola outbreak of 2014 is that if we have resources on the ground that are obviously working on a certain project, they could be reshifted to work and support any national strategies to address an emergency. We learned a lot of lessons from the Ebola outbreak, and we are being more proactive this time when we have community health workers, Red Cross volunteers on the ground who are mandated to do certain activities according to the project. Then how do we communicate with them, give them the resources, link them with the local health authorities if it's a health emergency like this one, to be part of a national response. We learned later that some of our resources at the time were actually used by the Ministry of Health because they find that handy already. So that is what's going on with how to adjust the operation, and based on requests from our local partners. I suppose, Jessica, when you mentioned that of some of the strategies I mentioned earlier on milestones for the specifically the PSMNCH project we have in Mali, which is part of the partnership department MNCH call, it has been extended for 1 year. But because we have financial resources only to extend for 6 months, we've been working on the end line and the evaluation planning, and everything has been put on hold while we are at a very advanced stage of our planning. Data collection was supposed to be very soon. So we are looking into alternatives in case the situation prolongs, and because it's a MNCH project, we are thinking of using the HMIS, the Health Management Information System of the Ministry of Health, and compare data of years. It may show a change in the demand for service, and we may be able to see whether it is related to any activities done by the project. We could also use project data that's been collected over the past 5 years, a lot of it on service delivery and quality of care. We could use phone calls to talk to key informants with the Ministry of Health at different levels and other partners on how the project, or to what extent the project helped in improving health services, increasing demand. These are the strategies that we could use. We were also part of the testing radar tools of Johns Hopkins University. Radar tested 2 tools, implementation strength and quality of care, in our Mali project in 2018. These are independent assessments that we could use their findings to show to what extent we were able to meet some of the objectives. These are just examples of how to have alternatives under the current circumstances. We are still discussing them. We will discuss them with our partner, the Mali Red Cross, and then we will come up with some suggestions to Global Affairs. Another example is we're right now starting a new project in South Sudan on menstrual health hygiene, and we are in the process of developing the PIP and the baseline. Again, both milestones are at an advanced stage, and data collection was supposed to be actually this week. So we are looking into alternatives, and we have reached to our desk officer in Global Affairs. They agreed that to postpone the baseline data collection to start with whatever activity is possible to start with, and we will collect data later, and we will readjust the data collection tool to reconstruct data prior to the intervention. We could also use secondary data, whatever is available and applicable to the project from national surveys. As to the PIP, they advised that the PIP could be done in a lighter manner, considering that we were planning as usual to have a field trip and a team would go and have a workshop there. All that is not possible. So a lot of it's going to be done remotely with the partner. These are just examples to show how we are trying to adjust and discussing, and we would reach out always to Global Affairs to have a decision that is doable under the circumstances. Thank you.
Thank you so much, Louis. I think that's really great. And I'm sure folks here who want to follow up with you on a couple of those points will reach out to you directly to do so. One of the things that you raised, I think, is interesting. I'd love to know more from folks here. So feel free to note in the chat if this does apply to you. You mentioned tapping into HMIS. And I'm just curious to know if that's something that organizations on this call are already doing as part of their work, or if there's some support that CanWaCH can provide to you, if that's something that you're not familiar with, but you want to have a better sense of what other data might be out there for you. And you also highlighted advocacy, and that was something we heard from folks, that questions around how to do effective public health campaigns and advocacy is a real challenge. And we've noted that at CanWaCH as something that where we may be able to connect folks who want to further discuss that and talk about different strategies. I also, you mentioned the Radar suite of tools. I believe we have Bianca Jackson and possibly Dr. Neff Walker on this call as well from Johns Hopkins. Glad to have them here. But I've also shared a link to those tools if you're not as familiar with them. And we're happy to connect you directly with the JHU team. Bart Dickinson, I believe, is also here on the call. Bart, you as a member of our metrics working group as well. Hey, Bart, good to see you. And Bart, at our last metrics working group call, you talked about some of the things that Louis mentioned, particularly from your perspective as, you know, Primates is a small to medium-sized organization. You were also talking about some of those data collection challenges. Could you share a little bit with folks what you're grappling with, but also some of the strategies you're using?
Thanks, Jessica. Yeah, no, just to point out, so we were fortunate enough to finish all of our data collection processes in advance of sort of society going on complete lockdown. It's hard to believe 10 days ago I was in Kigali in a hotel room worried about how I would get home, and now I'm in my basement watching my socks dry in front of me. But it's one thing that was raised, at least internally, that we wanted to kind of bring to Global Affairs' attention is the situation where a lot of organizations hold many of their assets and equities, and obviously right now is not a great time to cash in any equities you have to get the liquid assets. You need to finalize payments to projects that are closing out. So we'll be in a fortuitous position to report and finalize all of our reporting on our closing PSM&CH grant project. However, the question of the Global Affairs holdback was something that has been raised internally because in normal circumstances, we'd be able to essentially liquidate the assets to get the funding we need to finance final project expenses. In this current context, however, you could understand why an organization might be loath to do that. I'm not particularly the right person to be talking about that from my organizational side as the M&E coordinator, but that is something that when we're talking a lot about flexibility, which I can appreciate, you know, in real terms, we have expenses made for programming. We're going to be able to finalize our reporting, but the question of, you know, when funding can be released, or whether or not there's any access to that holdback in the interim to help facilitate some of those final expenses is something of ongoing concern for organizations like ours.
Absolutely, and we've heard that loud and clear as well. I know Global Affairs, our colleagues have heard about that around the funding disbursements, and folks wanting to talk a little bit more too about how we might, as things continue to shift and as there's uncertainties, if there's ways that we can collaborate together to provide some relief or support. Also on our recent call, we had our colleagues from World Vision Canada, and I believe we have Carolyn Marshall and Melanie Gillespie here. And you guys had shared a little bit about what you were working on, but as well, one of the questions that's come up from folks in advance of this call was about talking and communicating in a transparent way with in-country partners, right? How do we talk with folks? What are the conversations that we are having with our global partners, particularly our partners in areas that maybe are not currently affected but are anticipating and preparing? Carolyn, I believe you were going to speak and share. Can you tell us a little bit about how World Vision is thinking through these challenges?
Yeah, sure, Jessica. Are you able to hear me?
Yes, I can.
Okay, great. So, so for World Vision Canada specifically, we're focusing on 16 countries that we think are the most vulnerable, and World Vision as a partnership has identified 17. Our concerns are really focused on, as you mentioned earlier, countries that are in particularly vulnerable situations due to conflict, fragility, that sort of thing. So what we're looking at doing with a lot of our programs right now and grants where it's appropriate is shifting a lot of our activities to focusing on preventative measures to stop or slow the spread of COVID. So we're looking at WASH-related behaviors, engaging with community health workers and volunteers, supporting health systems and workers wherever possible with personal protective equipment and any treatment supplies that we might have. That includes helping with training, again, of community health workers. And another key area of focus for us is multi-sectoral support, particularly for children impacted by this, whether directly through illness or because their parents and grandparents might be getting sick. So that's looking at supporting the education system where we can, including homeschool, child protection, and livelihoods. And so I think for us, we're trying to really facilitate transparency within our own offices by coordinating through a central mechanism and collecting information from our programs to see what the impacts are on them and what we can do to help support them through this. And it's very much a work in progress. And so we're just trying to communicate things as quickly as they are changing with them.
Great. Thank you, Caroline. And you mentioned that there were a few different priority countries that World Vision is working in. And as we'll talk about in a moment, what we'd love to do is see if there's an appetite to connect folks who are working in those countries right now to talk a little bit about how we're sharing information. But this actually segues really nicely to Mark Brender from Partners in Health. We were chatting a little bit about the work that Partners in Health is doing actually in response to COVID-19, some of the guidelines that had been created. And I believe Partners in Health also had some SRHR projects on the go. So curious if you can share a little bit from the perspective of an organization actively and already talking about responding to COVID-19 within your work. What is top of mind for you and what are some of the relevant issues and concerns that others might be facing?
Yeah, thanks, Jessica, and thanks for organizing this. Great to see so many people. I think so, yeah, as you said, we do have a couple Global Affairs Canada funded projects that certainly will be affected, mostly depending on what the burden of COVID is in the various sites where we work. And I think one of the things that our broader team has really driven home is that we really have no clue what the case fatality rate is going to be in the kinds of contexts where we all work. In part, two main factors really to the weak health systems. We're seeing what it's doing to health systems certainly in Italy and Spain and in the US that are really being overwhelmed. And obviously everybody knows where we all work that there just isn't the same, anywhere close to the same capacity for ventilators and oxygen and PPE, testing, so supply chain. So all that is going to have an impact, as will the vulnerability of patients. So we really don't have strong data around what will happen when you have COVID alongside HIV and TB and severe malnutrition. So that kind of, really accelerates the urgency of our response collectively, I think. And really in some of our sites, I think a lot of the African countries in particular have kind of sounded the alarm internally a lot quicker than we did, which is great. It is also making some communications very challenging, even traveling within the country, because they've closed down borders certainly very early, which is good. I think as far as our response, we're really focusing on kind of 4 areas, really trying to get testing as broad as possible. Some of the early data has shown that the ideal, from South Korea, that when you're doing enough testing, that the positive rate should be about 2% to do enough contact tracing to reach enough people. And obviously the percentage of people that are positive is much, much, much higher, which indicates we're not doing nearly enough tests for a whole bunch of reasons. So how can we really accelerate testing? We're trying to get rapid tests into the field. Another lesson learned from Ebola is that if the underlying health systems aren't really strong, if people start staying away from the health system because they're afraid of COVID, then we're going to have many more people die of maternal mortality, of malaria, of all kinds of other challenges than they will of COVID. And that really did happen in Ebola as well. So how do we make sure that there's very strong treatment at the facilities where we do work? That means strong isolation. That means building additional facilities. It means kind of building triage routes within facilities to do that. I think the third piece is really around contact tracing. So mobilizing community health workers to be able to really get into communities, and that goes along with testing, but making sure those links with facilities are really strong. And then the last piece is really accompanying ministries of health so that we're not building parallel systems, that we're supporting national systems, and then facilitating their ability to kind of hopefully scale and expand treatment across countries where we work. So I think those are things that we're really, really concerned about. And I think really kudos to Global Affairs Canada for the flexibility that you're showing, because if we don't collectively really respond to this, then it's going to undermine the work that we are doing across the sector in a whole bunch of areas.
Thank you, Mark. And I think that's absolutely something that we're going to want to talk about in future conversations as well, are these intersections with the other areas of work that we will no doubt see being impacted.
Can I just mention one more thing quick, Jessica? Sorry.
Of course.
There's Partners in Health has put out some clinical guidelines for in-facility and in community that is on the PIH.org website. And they're open source, public use, so feel free to go find them, or I'm happy to email them to anybody. And they're being updated as we learn more and more.
Wonderful. We'll add that to the list of different resources that we see, and we can share it here in the chat as well for folks to take a look at. That's fantastic. Thank you for doing that. What you spoke to, and everyone has spoken to this issue of the data that we have and the data that we don't have, what that means for our own programming, but what it means in terms of making intelligent and informed decisions going forward. One of the organizations that I know of that's doing a lot of really interesting work around modeling and data is our friends at HealthBridge. Peter Birdie is here, I believe, from HealthBridge, and is a member of our metrics working group. And Peter, you, I know, have been doing a lot of thinking about how to understand and leverage existing secondary data in more effective ways. Could you talk a little bit about what's top of mind for HealthBridge at the moment and some of the things that you're investigating?
Sure, thanks. First, I'm gonna stick a link in the chat box there, and if whoever has the control could share that on the screen, and then I'll talk about it. So I think Louis talked a lot about using other data sources that are HMIS and process indicators, and Louis or somebody talked about also phone calls, interviews with field teams. So all those can be put together. Yeah, now there's the paper that y'all see. This is one of my favorite papers. It's been for a long time. And if you scroll down to, I think, figure 5, I think it's on page 13, is the summary of this paper. Yeah, keep going. And it has this cool project impact pathway, and a little more, and a little more, and one more figure. The next figure is there, that one there. Okay, so you see how they've got their different, the summary of the work going from inputs through impact. And so it's similar to the situation now where we may not have impact data or even outcome data, but we will, through the process indicators and so on, have some of the inputs and process data and output data. And it's not as good as having the whole flow chart, but it's, and if you're also familiar with the 10 or 15, maybe 20 years ago now, the work by Habich and Victoria on adequacy evaluation, plausibility evaluation, probability evaluation, if you've heard of that. So in an adequacy evaluation, what you're doing is do all the indicators point in the same direction. So in this HKI example, you see in each one of the inputs, I think, so the lightest background means it was working well. So in the top line there, the VMS were established, and that led to working well in the agricultural impacts, which led to the improved and developed gardens established, which led to improved increased vegetable production. And then something on the increased cost outcome didn't work well, so it hit a roadblock there. But all that chain of events linking each other is event. And now it's not as good as having actual data on increased income or on MNCH outcomes, but it does provide us with something in is the whole project working in the same direction up to that point. I mean, I think it's good practice to do something like this in any situation, but now especially since many of us will not have that final data set. If you just find is all the different pieces pointing, and HMIS data can fit in there too. Is HMIS data pointing in the same direction as your project data? In our case with our project, they're not all pointing in the same direction, which is really confusing, but hopefully you'll have better.
Thanks, Peter, and thanks for sharing that. You know what I think this speaks to, and this segues us nicely, and we only have a few minutes left in this call, and so we do want to make sure to talk a little bit. I mean, these have just been some small spotlights for folks about some of the major issues that are top of mind, but we know that these are questions and strategies that we are all going to grapple with. So the question then becomes, now that we are starting to know and identify between ourselves where we're similar, where we share some areas of concern or things we want to explore more, whether it is doing this kind of modeling and figuring out if it could work for our program, whether it is figuring it out how to talk to ministries of health, whether it is about getting clinical guidelines in that we need. How do we connect with each other meaningfully in order to do that work? So we'd like to take the last few minutes here to talk a little bit about some of the resources that we do have available at CanWaCH that we want to make sure that folks are linked into and have access to. And then finally to talk about how we can identify how to support you in connecting together and how we can have more focused, perhaps technical calls for those of you who are grappling with those individual issues. Melody, would you be able to tell us a little bit about some of those resources to start?
Oui, bien sûr, Jessica. Alors maintenant, ce que je voulais faire, c'est vous énumérer quelques ressources et outils que nous avons en place au KNSFE qui pourraient vous être utiles dans les prochaines semaines et les prochains mois à venir. Alors tout d'abord, les outils de collaboration en ligne. Au KNSFE, nous utilisons des outils de collaboration en ligne tels que Zoom, tels que Ring Central, par exemple, et nous pouvons vous y offrir accès au besoin. Contactez-nous au courriel indiqué sur la diapositive que ma collègue va vous montrer bientôt. If you're struggling right now to connect with your partners in the field, connect with us. We can give you access to our online collaboration tools. Ensuite, la mise en place du télétravail. Nous allons ajouter à la liste de ressources de ce webinaire, le webinaire que nous avons fait la semaine dernière sur le travail dans un environnement virtuel. Nous y partageons les meilleures pratiques ainsi que des conseils, des astuces, des expériences personnelles et nous parlons de technologies innovatrices pour travailler dans un environnement virtuel. We will also add to the links to resources, the webinar recording that we did last week on navigating a virtual workplace, and we recommend you check it out. Ensuite, nous avons de l'expérience au CanSfe avec la mise en place d'un réseau pour les organisations canadiennes. Au KNSFE, nous avons mis en place un réseau d'organisations et institutions canadiennes travaillant dans le milieu de la santé dans 2 pays, en Haïti et au Mozambique. Pour ces réseaux, nous avons identifié des points focaux qui font le lien entre le réseau et leurs collègues. Nous avons mis en place, par exemple, une bibliothèque virtuelle pour partager des ressources clés, ainsi qu'une liste d'envoi, et travaillons sur des thématiques prioritaires identifiées par le groupe. Contactez-nous également au courriel indiqué si vous êtes intéressé à vous connecter à d'autres organisations canadiennes qui travaillent dans les mêmes pays ou les mêmes régions que vous. My colleague will be sharing in the chat box an online contact sheet, and please feel free to specify in the spreadsheet if you are interested in connecting with other Canadian organizations working in the same countries or regions. On the spreadsheet, you can add your contact details and specify your priorities. And we are happy to help connections, to help facilitate connections between you all. And thank you, Antje, for posting the link. Jessica, maintenant à toi.
Thank you. So, you know, as Melody mentioned, so we've got this this document for folks who might want to connect on a few key things. And one of the, some of the areas I wanted to explore, and so would love for you to give some thought to and let us know, is whether or not you would find it helpful for us to convene some subsequent conversations on certain topics. So we've heard already that there's some interest around certain geographic areas. Carolyn from World Vision mentioned 17 different priority countries. It would be great for us to be able to know who's working in those countries, how you're planning to respond to that. We're happy to convene a follow-up call for folks working in those countries to talk a little bit more. If you would like to do that, please note your name and the countries where you work in that sheet, and we'll be sure to connect with you. We'll also leverage the Project Explorer tool that we have to identify who's working where. Other things that had come up were questions about whether or not it would be useful to have follow-up conversations with folks who are part of particular funding initiatives. So whether you are part of that group of projects funded under the Muskoka commitment and are kind of in that end line stage of things, versus if you have only recently started a project or currently have your PIP under review, would you like to have conversations specific to those particular needs? We're happy to convene that. Finally, we've talked a lot about the actual work in modeling impact. Can we get creative and strategic around that? I think that there is, and we talk a lot about this in the metrics working group, but there are a lot of kind of creative ways that we can go about talking about the impact of our work, and we're happy to do some capacity strengthening and connections with organizations. So if that's of interest to you, please identify that as well. And then if there's other areas too, there's a few we've heard around kind of public engagement and advocacy has been a big one. CanWaCH has a public engagement working group. I also know that some of the other councils, including the Intercouncil Network, are doing a lot around thinking about messaging to Canadians broadly and the impacts that that has for how we promote our work and the work that we're doing. So I believe we'll be having follow-up conversations on that as well. In fact, one of the things that we'll be doing at CanWaCH is over the next little while, we'll be moving to something called Webinar Wednesdays, where we will have a range of current and emerging topics that are of relevance to our members, not just relating to programming, but broadly speaking. So we encourage you to stay tuned to our social media channels or to reach out to any of us, and we can connect you with that. As well, we have another webinar scheduled to come up next week, which is going to be talking specifically about the needs and challenges of small and medium-sized organizations, lessons learned and opportunities there. That's scheduled for next Thursday at 12 p.m. I believe Antu has shared the link in the chat as well, if you would like to register to join that conversation. And so as we are at our hour mark, I just want to thank all of you for taking this time, particularly those organizations that shared insights into the specific challenges that they're facing and the strategies that they're using, and hopefully helped us to think about how we can connect into them and bring folks together to work together more effectively. We look forward to sharing this webinar with you, but also documenting some of these challenges and strategies, and trying to broker those connections wherever we feel we can. So with that, thank you so much for taking the time to join with us today, and we look forward to seeing you at a future webinar Wednesday, or in other conversations going forward. Really appreciate your time. Merci.